Tonight, we have the unique pleasure here at ASCO, the American Society of Geriatric Otolaryngology, to host a panel discussion about a very timely topic right now that is over-the-counter hearing aids. Just want to be upfront with some of the learning objectives so that we all can anticipate what the conversation is going to cover. So you see them listed on your screen. In short, we're going to summarize what the status quo of the availability of these devices are. Earlier reports from the summer talked about as early as October 2022, they will be available, but we're going to talk a little bit about what realistically right now is December 1st, what exactly is available. We want to differentiate who is a candidate for OTC hearing aids and of course specify who would not be a candidate. And with that said, we want to talk about some safeguards that are currently, that we know will be in place or we know we would like to see that they be put in place for consumer protection. And then finally, we're going to wrap up by describing how clinical practice may respond to the introduction of this new class of technology. So just very briefly, I'm sure we're all familiar with this by now, but just some guidelines. Please, we ask that you mute your microphones until you are ready to speak. In the event you have any questions, we will have some time at the end for Q&A. So please type your questions into the text box in the meantime. Auto closed captions are available, so please feel free to turn those on your end if you would benefit from those. And if you have any technical issues with Zoom, please send a message directly to Dr. Alexander Chern. He is the one who has the ASCO Zoom Square. So please, if you have any technical issues, please direct message him and hopefully we'll have a troubleshoot. And tonight, we are very fortunate to have this Duke University's Department of Head and Neck Surgery and Communication Sciences to sponsor some CME. And so for those of you who would like to acquire some CMEs, you see some of the respective details on your screen right now. And Dr. Chern will be copy and pasting some of those links into the chat box if you would like to access those directly. And I'll be showing this again at the end. So if you miss it, don't worry, it will come back again later. So now for some introductions. Good evening. So my name is John Swen. I am an audiologist and I'm currently training for my PhD here at Johns Hopkins University. And tonight I'll be one of the moderators, co-moderators with my colleague, Dr. Justin Golub.
Hello, I'm Justin Golub. I'm an associate professor of otolaryngology at Columbia University and honored to be here and lead this webinar.
And then last but not least, our esteemed list of panelists. And I'll ask each of you to please introduce yourself in alphabetical order as listed on the screen, please. If you can share your name, your clinical background, and where your current base or affiliation is, please.
Good evening, everyone. My name is Lindsay Creed. I am an audiologist and currently employed by ASHA, which is the American Speech Language Hearing Association. My title there is Associate Director of Audiology Practices, and I'm also our OTC policy lead as well. And before joining ASHA on staff, I was at an ear, nose, and throat practice for 8 years practicing audiology, and I'm super pleased to be here tonight. Thank you.
All right. Well, welcome everybody. My name is Jed Grissel. I'm an otolaryngologist. My practice is in Wichita Falls, Texas, and I have a private practice that is a sort of a traditional otolaryngology practice, and that's what I do for part of my job. And then the second part of my job is I'm the chief medical officer for a company called Amplify, and we specialize in putting audiology into optometry clinics. So that's what I do.
My name is Carrie Neiman. I am an otologist at Johns Hopkins and core faculty at the Cochlear Center for Hearing and Public Health.
Hey everyone, I'm Nick Reed. I'm an audiologist by background and training, but faculty in the Department of Epidemiology at Johns Hopkins University.
All right, thank you. So we'll get started with our panel discussion tonight. Dr. Golub.
Excellent. All right. Well, I'm excited to begin the first part of the panel. So we'll just begin with some questions. And as may have been mentioned, if there's audience questions, we'll try to get to those at the end. So there are several device options available for delivering healthcare in adults, and these over-the-counter hearing aids are just the newest class of technology to enter the landscape. So just as a first question, the basics. So to our panelists. How do over-the-counter hearing aids differ from devices such as PSAPs, and you can also say what PSAPs stand for, that have already been around and are available to consumers and have been available to consumers for a long time now? Anyone can feel free to jump in.
I can jump in a little bit here. So the main difference between them is who they are intended for. So what their intended usage is and how they are classified. PSAPs, which are personal sound amplification products, are electronic. They are electronic products. They are not medical devices, and they are intended to only provide situational hearing enhancement. So like a boost of hearing in certain settings or scenarios, and they are defined by the FDA, but they are not regulated since they are not medical devices. OTCs are the newest category of hearing aids, and they are medical devices. And as such, they are subject to regulatory controls from the FDA. This can be confusing from a consumer perspective because from their perspective, they can function in exactly the same. And there has been research to even show that PSAPs can provide hearing enhancement for individuals with hearing loss. But the biggest difference between them is that they are not intended for those individuals with hearing loss. They are intended for individuals with non-impaired hearing.
Got it. So just a follow-up question. Let's say there's a PSAP available for $300 and an over-the-counter hearing aid available for $700. Is there any benefit to buying the PSAP? Like, will it be adequate? What are the pros and cons of just going for a cheaper, less regulated PSAP?
I think it depends on the specific product. You would have to run some testing on it to see exactly what the electroacoustic output of that device was. But the consumer benefit of a OTC hearing aid would be the consumer protection, the regulatory requirements that the manufacturers must comply with in order to market it as such. So it's going to have a lower output limit. It's going to have certain labeling requirements. So if I had two devices in front of me that were the same price point, I would probably recommend the OTC. But that being said, without doing specific testing on the two devices to compare them exactly at face value, that's hard to say.
Yeah, makes sense. What companies already have over-the-counter hearing aid devices for sale now? Like, what's the summary of the landscape currently? Nick, maybe you could field that one if you know. I think you're muted.
Oh,
Doesn't-
double
now-
mutes. I think officially we only know of two approved OTC hearing aids, and that's Lexi, which is by the Hearex Group, and they partnered with the Bose technology, and then the New Hera, which has partnered with Hewlett Packard. We know of intentions for OTC products from the Sony and WS partnership. I believe Starkey has put out some information that they are exploring the OTC space, and GN Resound is entering the OTC hearing aid space. So we don't know for sure other companies that may enter. We know that there's research going on out there, but who will enter in the long run is a different story. And I think that actually is a pretty reasonable thing to only have a few right now. It's going to take a really long time for this market to actually sort of shake out over time and see who enters it, who stays in it. I think it's a bit of a Wild West period for at least the next 6 to 12 months.
Yeah, that's a great response. I appreciate that. Now that over-the-counter hearing aids are available, where can people purchase them? And it's supposed to be drugstores. Is it literally every drugstore now, or just one out of every 10 Walgreens? How available are they today?
They're everywhere. I think we've all seen them probably. Maybe I'm just paying more attention sometimes when I'm in these stores, but they're in all the pharmacies. They're online. They're in some consumer electronic stores like Best Buy. Walmart is carrying them. A grocery store, Hy-Vee, which I wasn't familiar with. I had to look up. I think that's in the Midwest, is carrying them.
HIV, it's called? HIV?
HY-VEE. Is a grocery store that is selling them. that's what I know for sure. Amazon and a lot of other online retailers
Heard of
as
that
well.
one.
Mhm.
Jed, do they sell over the counters at the Walmart in Wichita Falls, Texas?
They sell them at, let's see, am I off mute here?
Yeah.
They sell them at the Walmart and every single Walgreens. And we're a nondescript, average American town, and you can get them at
Oh,
every Walgreens here. Yeah.
I went to my local Walgreens this weekend just as a test, and they weirdly had them behind the pharmacy counter. I went at 9 p.m. and the pharmacy counter was locked. So you had to go during pharmacy hours to buy one. Has anyone had that experience as well? That's where drugstores are putting them.
Yeah, behind the counter.
Right. I imagine you don't want to get stolen, but behind the pharmacy would, limit the hours it could be sold.
Yeah.
I was literally standing in line at a pharmacy to get a medication for my daughter the other night and was about 20th in line at a CVS. And I noticed the display next to me, and what you had to do was take a card and get in that line. And I thought that was what a barrier, because if I saw that line, I probably wouldn't have wanted to get in it. But I do understand that they want to kind of have some safeguards in place. I think it's a balance, though. I think it's like Nick said, it's going to be a little bit of a wild, wild west. I've been using that quote of his a lot. And I think that some of these retailers are going to have to learn what works and what doesn't work, and maybe change some things up over time.
Right. Makes sense. Maybe soon we'll be able to buy them in airport vending machines next to the Bose noise cancellation headphones. I bet you will, because forget your hearing aids on a trip and you want to be able to hear. John, I'll turn it over to you for segment 2.
Yeah, so next segment, we're going to talk about the user or the consumer. And so first of all, just like with any other various devices that we have available in clinics currently, OTC hearing aids are intended for a specific population of people. So I want to first start off by asking, who could benefit from using OTC hearing aids, or who is in the intended user?
Well, I guess I can jump in here, but I'm gonna probably butcher it because Nick Reed's on the call, so he probably knows this a lot better than anybody. But I think it would be good to just talk a little bit about. I think it would be good for the listeners to just talk a little bit about the FDA indications, right? So when this FDA went through all this for years of back and forth and different people getting involved in describing who is the intended patient. And so for OTC hearing aids, these are patients with mild to moderate hearing loss that are self-perceived mild to moderate hearing loss. And I think that is a huge thing that the FDA put in there, right? Like, I think that, I don't know of anybody who can sort of self-describe whether they have mild to moderate hearing loss. But I think that's an important thing. So it's perceived mild to moderate loss. And then also these devices have certain output limitations. I think the final output was it 120 dBs, Nick? I think it was 110 and then increased to 120.
It's 117.
117. Okay. The 117, and another interesting feature I think that kind of caught my eye was unlimited gain, right? So there's unlimited gain, which I think there's pros and cons of that, and some controversy about whether that provides whether a device intended for mild to moderate loss really needs to have unlimited gain, and whether that presents a safety issue to patients. But I think those are kind of the key features.
So just to orient everybody, we're going to talk about safety and regulations in a moment. But I think that's often the main things we hear about in terms of who is a candidate. They need to be adults over the age of 18 and to have perceived mild to moderate hearing loss. And so therein, I think it's easy to surmise then who would not be a candidate, right? It'd be pediatric populations, and of course, those with much more profound losses. So with that said, besides age and hearing loss severity, then, what are some other indicators that would preclude a person from using OTC hearing aids?
So also, I think some of those red flag scenarios, like sudden onset hearing loss, unilateral loss, vertigo, pain, drainage, kind of a lot of the similar things that audiologists use as red flags to decide whether they're going to need to see an ENT doc would be preclusions.
Absolutely. And I had thought about this previously, where I wonder if it would be a requirement for over-the-counter boxes to have these indicators. Does anybody happen to know the answer to that?
There is a labeling requirement of a warning when to see a doctor, and it lists out the red flag conditions. I forget off the top of my head if that's an outside the box or an inside the box labeling requirement, but it does have to be able to be consumed by the potential buyer prior to purchase. That I do remember. And so it lists out like birth defect of the ear, abnormal shape of the ear, like surgically altered ear, anything draining from the ear, blood, pus. It talks about ear pain, discomfort, vertigo, everything that Dr. Grisel just said. Asymmetric hearing or tinnitus, sudden onset, fluctuating loss. Yeah, it does mention those things.
Great, thank you. So this is a relatively, I'm trying to think if there was a follow-up that I wanted to ask, but I think this was a pretty straightforward section when we talk about the user. Adults perceive mild to moderate, and obviously those red flag symptoms. Carrie?
Yeah, I can just chime in just a little bit in terms of when, if you're thinking about in terms of from a practicing otolaryngologist perspective, and if you have somebody in front of you and you are starting in your conversation about hearing aids, vast majority of the time, I will say, like, at least prior to OTC hearing aids, I generally talk about PSAPs alongside many of the other options out there. Particularly if somebody is sitting in front of me who has, the bread and butter, age-related, symmetric sensorineural hearing loss. I think as you're thinking through whether or not to bring this up with the patient, I think some of the other things that you need to be thinking about for the user are some of their tech use and their openness to do they have a smartphone? Do they know how to pair their smartphone with their device? Things like that. So I think there's some of those other aspects that are kind of non-medical that need to be a little bit in the back of your mind. And we can talk more about that potentially later, but I think those other aspects, as you think about the individual in front of you and what it takes to kind of navigate as an older adult in particular, some of these things, I think that's always something that should be a little bit in the back of your mind.
Appreciate that, Carrie. I was actually, before, when I asked the question, who would be a good candidate, I was actually wondering if we could talk about like a typical profile of a patient in the clinic, like who are they? And like you said, somebody with the so-called bread and butter, symmetrical, age-related hearing loss, no other medical complications, no other contraindicated case history. So absolutely. Justin, I'll throw it back to you to talk about a very significant topic of this, which is the safety and regulations of OTC hearing aids.
Actually, right before we jump into my segment, I had sort of a trailing question about the ideal user for the devices. What about tech savviness? Because I've encountered a few people, 80 plus, who have mild, moderate hearing loss that state outright they can't afford a hearing aid. They can't afford $2,000-$3,000. They're on Medicare, they can't get it covered. And I mentioned the over-the-counters, and then I'm thinking, how are they going to program this thing? They barely know how to use their smartphone. So how easy are these devices to use? And do you think tech savviness is going to be a limiter? Because a lot of these people who are candidates, they're old, they're not that tech savvy. They would have to recruit their kids to be doing everything.
Yeah, I don't, Nick, if you want to weigh in or not, I will just initially, and then if Nick, you want to chime in, I will say, in every kind of spiel I give to the individual in front of me in a clinic-based setting, I do bring up OTC or PSAPs just because I want to always say, I don't want cost to be the reason you don't do something about your hearing loss. But then I may provide some additional counseling if I am concerned about some of the tech use and their support. So I do think if we're going to provide kind of holistic patient-centered care, you need to be thinking about who in their support system do they have to call upon potentially to help them when they can't connect via their Bluetooth when, it's not quite showing up in the app or, whatnot. And you need to be thinking about the technology side of things. I think we will probably have a little bit of time maybe later to talk about some of the models and things. I will say, from our work in Baltimore with older adults, working in affordable housing and things like that for the individuals, that we've worked with there, we know many of them do not own smartphones. They don't use computers and things like that. So there's a real opportunity, I think a real need for how do we kind of go that last mile and connect individuals. So I know that the Hearing Loss Association of America has a couple really basic tip sheets out there to kind of walk through whether or not you think an OTC device. So at least in a clinical setting, that's kind of a neutral source to draw upon in terms of the Hearing Loss Association of America and some of the basic things to kind of think through or help your patient think through, is this the right option for me? So.
Yeah, that's a great point. When I'm counseling patients, in an ideal world, everyone would get prescription hearing aids. And I always say, ideally, you get prescription hearing aids. And clearly one of the advantages of that is you have a, super trained doctor level audiologist doing everything for you. I mean, that's what you ideally want. If you can't get that, then you can go and figure it out for yourself. So I think, part of the premium experience of a prescription hearing aid is you're going to get someone to do everything for you. You don't have to do any work. You just show up and they fit it for you. I don't think OTCs will ever match that. They just can't by definition. And that's just the nature of the device. It's just built into what this entity is. So let's move on to the safety section. Oh, was someone going to comment on that?
I was just going to say that I think, and we'll talk, I'm sure, about this more in kind of the clinical integration of models, but I think the ideal patient that this is the patients that we've never seen, the ideal patient is these patients that will never come to our clinic. Right? Like these people that, by the time the patient has navigated the system and gotten a referral from their primary care doctor and ended up in the ENT doctor's office with an audiologist, those patients are committed to their hearing healthcare, right? So to me, there's this huge advantage for these 80% of the people who never enter the system to get access to something, right?
Right. Yeah, exactly. Agree with that. So let's move on to the safety segment. So I think we all agree that the health and safety of our patients is sort of the number one priority. And the goal of over-the-counters is to help society at a broad level, to help people with hearing loss at a broad level, but there's potential risks in doing that. So we've covered on a little bit of this, and I have some specific questions, but just to open it with a general question. What are the general safeguards in place, the principles of this to uphold user safety with these over-the-counters? Someone could chime in, just maybe summarize briefly. Lindsay looks like she wants to answer.
Feel free, Lindsay.
People do want to hear from me so much. Nick's really the expert on this, probably. There are device requirements. So there are certain electroacoustic performance characteristics that the devices must meet. So someone mentioned the output limit earlier. There are also maximum insertion depth that they specified in the final rule. There are certain sound quality requirements in terms of smoothness of the frequency response so that the user has a decent sound quality. It can't be too peaky. It has to have a certain bandwidth. Then there's also labeling requirements as well, inside the box and outside the box labeling requirements. And then there's some conditions of sale specified as well in the final rule. So design requirements, which are your technical specifications, and then more of your labeling requirements and conditions of sale.
Great answer. Anyone want to add something to that? Otherwise, I'll dive into more specific questions. So that answer is, it's great, and all that stuff is great. It's great in principle, it's great in fact. But then I've been thinking more about all these scenarios where I don't really want people to be using over-the-counters. They would be using it inappropriately, and how would the system prevent that from happening and steer them towards an audiologist and a physician, because patients have a true medical problem. So one issue is these devices are not supposed to be used by kids. So what are the safeguards in place to prevent that? I mean, clearly Walgreens could card you if you're trying to buy an OTC, right? What if you buy it on Amazon? How do you prove your age limit? And then couldn't you get your older brother to buy them for you? You know, sell them to toddlers on the black market or something. But in all seriousness, how would that work with preventing minors from using them, kids from using them? Because we kind of don't want that, I think. And feel free to say there is no answer to that.
I was gonna say, I think there isn't. I think there isn't some perfect answer to that. I mean, this is the nature of OTC and the nature of many products in the United States. I mean, say what you want about all sorts of different things, and I know things like guns are hot topics, but this is just feasible in terms of purchasing things that we're given, the right to purchase to some extent. Earlier today, John Swan and I were talking about Tylenol is potentially dangerous, and these same scenarios technically come up, right? But we still sell it, and
Yep.
we don't really think twice about it.
Right. I agree. To some degree, the responsibility is with the consumer. Exactly. I'll also point out the Q-tip box says on it to not place in the ear canal, but we all know how that goes. More specific. So asymmetric amplification. This is a big sticking point. A lot of people who are against this are very worried about someone with an acoustic neuroma will be using over the counters for years and they have a growing brain tumor. Not dangerous when they're small, dangerous when they're large. What are the controls in place to prevent someone with an acoustic neuroma and hearing loss that's asymmetric from using the device? Clearly, it could say it on the package, do not use if you have asymmetric hearing loss, translated into plain speak. But you could easily have engineering controls for that, right? Like the device could only be symmetrically, could only work symmetrically, right? You should be able to have asymmetric gain. Is that a built-in limit of the device? Does anyone know that? What?
From
Really?
my
I'm
understanding
surprised.
of the rule, it's not built in. There's nothing precluding manufacturers from allowing the devices to be adjusted independently. They do recommend in the labeling that anyone with perceived asymmetric hearing loss consult a medical provider first. I have looked at a lot of the technical specifications and product information for the devices that are currently available. And what you'll see is that most of them are only available in pairs. They're not, you can't buy the individual unit. And I've read a lot of the Q&As from people that potential consumers that are looking to buy this that either have an asymmetric loss or a unilateral loss, and they have been through all the proper channels. They've seen the audiologist, they've gone for a medical evaluation. They want an OTC because it's what they can afford, but just for the one ear. And the response of the one manufacturer I was looking at, the Sony device, was that you would have to purchase the pair, set them up as a pair, but they independently set for each ear, but then you can stop using the one device, but you have to set them up as a pair. But there is independent settings for right to left, but you just can't buy one and set up one for a lot of these, unfortunately. Right.
Got it. That was my other question is, could you use it unilaterally? Can you just take one off and just wear one if you have, say, an asymmetric hearing loss and your good ear is normal? I guess the answer is you can do that, which is good and bad. I guess it's good for people who have asymmetric hearing loss. They've been through the proper channels. They had an MRI. They don't have an acoustic neuroma, but they can't afford prescription hearing aids and they want to do something. But it's not good for someone who's now going to procrastinate getting that MRI. And I guess that's just the risk inherent into this product category. I wonder if.
Yeah. I mean,
ahead,
I think that, some of the research that led to all of this, more direct access to audiology and OTC was, the President's study, which it's been a little while since I've read the details of this study, but basically, that probably creating barriers to access to hearing technology is more we're going to hurt more people by doing that than the one acoustic out of that is occasionally missed by not seeing the doctor first, and so I think that we have to weigh the benefits to the masses versus the risk to the few, and of course put all the safeguards, but I think that in all these are devices that are much safer than handguns. We'll just put it that way. And
you're from Texas. I'm surprised you said that.
and they're available, and they're gonna, and they can help people and stuff. So I think that we just have to weigh those pros and cons.
Right.
I actually would chime
Great
in
point.
that there is a counterfactual here, that we're focusing on the concept that people will miss more. But in a very exclusive system as we have now, we may be missing more acoustic neuromas by not having entry points to this pyramid of hearing care. And if OTC actually comes in as the low point on the pyramid that increases access to the funnel, we may end up actually capturing more. I mean, there are I seem to remember reading, and this is like a long time ago, but a study where they were looking at post-mortem several people, and they were looking at like the incidence of acoustic neuromas, and it was like, or prevalence, it was so much higher than we've ever estimated based on clinical data. And so we're clearly missing a lot now, if that study is true. And the truth is, this is like an old cadaver say. I do not know how right it was or not, but I think there is a point, to Jed's point, we could be, thinking sometimes the wrong way about this. We're always focusing on one side, and maybe there's another side.
Yeah, that's a great point.
I would just add, I think throughout this discussion about OTC hearing aids in general, is that tension between that one-on-one medical care that we want to provide, kind of that best quality care to the patient who comes to us in our clinic, versus the public health need of, the 80%, over 80% of 80-year-olds in the US who have a clinically significant hearing loss. How in the world are we going to reach that population? And so I just, the more we kind of think of it in terms of that person in front of us, as well as, this is part of thinking about that bigger picture. I think that's one helpful reminder as we're, because there are always going to be tensions between those two. And it's not a tension that I think we're used to thinking about in kind of the hearing care space.
Yeah, I do think that if you're fitting one of these devices with your iPhone and it does your audiogram and it's asymmetric, I feel like there should be a pop-up like warning, asymmetric hearing, this requires medical evaluation, something, an active message. I mean, sure, there's a product insert, but who the hell reads a product insert? Like nobody. How many people are going to read all the fine text of it? Nobody's going to do that.
Yeah, Justin, to piggyback off your point, I've looked at the way that kind of a little bit in detail of how one of these up and coming technologies will be deployed. And the way they're kind of looking at it is sort of 3 tiers. And one is self-fitting, you put the device on and it kind of runs you through a very basic sort of hearing check. And just to determine which setting to the device goes on. And then the next tier is kind of a customer service type person that somebody can call and get advice from. And then if it seems more involved, then the third would be like an audiologist or a hearing specialist that then can decide if this person. So they're trying to create some tiers of support for folks. And I think that that's good. And there should be some stuff baked into that, right? Of like, oh, this is asymmetric, this is dangerous to not, I think it creates more opportunities to have those discussions with patients about dangerous situations to get them to the right person,
Right. Got it. Okay. Got it. All right. We'll shift to a more general question. We sort of touched on this before, but this is a question I've gotten at least a dozen times in the last couple of weeks. What would be maybe like a 2-3 line response to a patient who comes in and just says, what is the difference between these over-the-counter hearing aids and prescription hearing aids? Maybe we'll start with you, Carrie, putting on your clinician hat.
I think it depends on who's sitting in front of you in terms of if kind of their degree of hearing loss and things like that. I would say not so much in terms of, from their perspective of, it's a device that's going to provide you ideally the boost that they need, where the differences start to come in terms of what kind of support that you're going to have in terms of navigating the marketplace, purchasing it, getting it fitted, understanding how to set it up, understanding, you know, the learning curve that comes with, you know, having, you know, sensory management through amplification, you know, those types of things that, you know, hearing aid, you know, instrument specialists and audiologists and everybody, you know, are trained to kind of walk people through. That's the support difference, and the ability to have somebody to kind of walk you through those things are going to be the biggest difference from just insert, you know, older adult with, you know, age-related hearing loss. So I don't usually get into too many of the minutia in terms of like, oh, does it have a telecoil and, you know, things like that, remote microphone, you know, whatnot. I'm, you know, thinking more in terms of, you know, how do they get access to the technology and how do they get comfortable using it, and start integrating it into their daily life, is the biggest difference from my perspective.
Good response. Anyone have any subsequent comments?
I have this conversation on a daily basis with my patients, you know, and basically, you know, I tell them that an OTC product is something that's a few hundred to say $1,500. It's bought over the counter. It's not necessarily customized specifically to your loss, and it doesn't involve a health professional to support. Whereas in our practice, we have an entry-level product that's $1,500. You know, so we kind of take up where those leave off all the way, and then we go up from there. But it involves a team of an audiologist and a physician to look in your ear, to provide an ear exam, to support that. Sometimes there's warranty differences. So we just kind of like walk through some of those differences. And I'll tell you, I mean, in some ways, OTC is the best way to sell hearing aids, because when patients see those differences, they're like, oh, well, why wouldn't I just go with somebody who can actually take care of me, you know?
Right. I try to, yeah, when I'm talking to patients, I try to say, you know, you can either do it yourself or you can have someone do it for you. And, you know, the American mindset, we want what's easy. So that would be a prescription hearing aid. You just let a professional do it for you, but not everybody, you know, has the resources to do that. Okay, last question.
Just real quick, and I will also
yes,
say in
Karen.
terms of that conversation, I think because of the price point that many of these devices have entered at, that conversation has been, yes, I think because they've come in at such a relatively high price point, you know, it is, you know, I'm talking about Costco regularly. I'm talking about all of these options, you know, and they're not that different, you know, in terms of the price point. So my hope for the future is that the price point comes down for these devices. And then I think it does start to become a little bit of a different conversation, similar to having, you know, talking about PSAPs in, you know, kind of in the past. That I think is one thing that is part of it too.
Got it. Final question in this segment. What do we call things like AirPods that have hearing aid like features? Like I used to know how to do this and I forgot the name of it, but there's a button you can toggle on your iPhone settings to have, I think, conversation boost, right? That turns your AirPod Pro into a quasi hearing aid. What is even the product category called? I guess it's just nameless. Maybe Nick, you want to field that?
I'm going to say it's nameless. There's a study from the UK before Melanie Ferguson moved away from University of Nottingham that they ended up doing like an Adelphi style, and this was before the current OTC regulations, and they were just trying to define what OTC means, what direct to consumer means, what PSAP really means to people, what we call the AirPods, and they come up with things like hearables and audio tech, consumer tech, like consumer hearables. And
Hearables, yeah.
there's no official category for a lot of these things, and we use a lot of these terms interchangeably.
One last question. I know I'm going over my time limit, but I just want to hear the answer so bad to this. Do you think there's going to be like a complete convergence where these devices that are purely consumer, you know, technology products like audio, like headphones, basically earpods, if they will become hearing aids, and then over the counters are doing, you know, earphone like features, and you can't even really tell the difference between the two, other than I guess what's allowed to be the label on the box?
And for me, I do think we'll see those. I actually think the sort of unique thing about OTC is that we tend to think of it in a linear fashion where we're like, oh, we have hearing aids over here, and these are taking the traditional model of hearing aids, and we're just, you know, making them sort of in a direct to consumer pathway. But the truth is, it sort of opens up like a whole new concept around, you know, integrating hearing into your everyday life, and consumer tech companies that may think of it as a true lifestyle device and market it that way and move their products in that direction. And so I think that we'll see super high tech companies like Apple. You know, will Apple ever call the AirPod a hearing aid? Probably not. I mean, why would they, right? What's the point in really doing that? But having all the same tech in there that, you know, can do something for someone with mild loss. And to the opposite end of the extreme, and I think this is relative to what we were talking about earlier, I think we'll see products that fill that niche market of low tech adults who need something that they can use. You know, we've relied on pocket talkers, handheld amplifiers for a really long time, and they haven't seen much, you know, tech innovation, and we may see that sort of blow up a little bit as a spot. And hearing aids themselves, OTC products, you know, fitting super low simple tech areas. And I think this is important to realize that what OTC sort of does is open a market that traditionally has only ever evolved in a linear fashion instead of a horizontal fashion.
Right. Fascinating. Cool. Awesome discussion. All right. I'll turn it back to you, John.
Yeah, thanks, Justin. So we're going to shift gears a little bit and start talking about what exactly does an over-the-counter model of hearing care looks like, because a lot of details do remain unknown in terms of how it can roll out and how it will actually impact clinical practice. So Lindsay, I actually want to get your input on this first. How may clinics, both standalone audiology clinics and ENT audiology practices, evolve with the addition of OTC options?
Yeah, so I think it's going to be up to the individual audiologist or clinic to decide how they want to incorporate these, whether or not they, I think the easiest thing to do is to just include them in your arsenal of devices that you recommend to a patient when you're doing their audiologic evaluation and communication needs assessment. It's just another option that you present to them. You could then take it a step further and say, I'm going to service or provide counseling or AR services for individuals that end up purchasing these on their own so that they could still get the support of a professional. And then I think you're going to find some that even try to incorporate them, like have a point of sale at their front desk or whatnot. But that's going to take a little bit more in terms of training and bandwidth of front desk staff, because if you truly want it to be OTC and they come in and purchase them and they're not buying, you know, your time and services, you have to be able to field some of those questions because, you know, there will be a lot of them at the front desk. So I think it's just kind of figuring out, and it can be fluid. I mean, we're going to learn so much over these, you know, coming months to years about what you, how you want to incorporate them. I think it's important that we know that a lot of these individuals are going to need help. I mean, we see that just from working with individuals with prescription devices, trying to pair them to their phone, trying to get them in the right way. They're going to need help. And I think that we need to be there to help them. That's why we got into this field. But there's going to be other choices to be made too. Like, are we going to be able to buy them at wholesale from the manufacturers? I don't know. And if we can, will there be any, you know, is there a rule about any markup, or what, do you just solely leave them at your front desk? You know, there's a lot of decisions, I think. But ultimately I see this as a big positive for audiologists, because we're only servicing such a small percentage of those who could use our services. And if this gets them in the door, if this gets them into a pair of hearing aids, that's a win. That's a win-win.
Yeah, I agree. I think, you know, when we're in the clinic, we are, like you said, we're seeing people who are coming to us, but oftentimes there may be other reasons, right? They may be having ear infections or other medical conditions. That's probably what brought them in, but not necessarily the hearing loss itself in the first place, right? And so there's certainly most likely so many, we know from data, population data, there's so many people out there who do have clinically significant hearing loss, and they probably may or may not have medical conditions, but they certainly are not accessing hearing care because they may not think it's for them, because they don't think they need it. Absolutely. Jed, I would like to get your input as well as somebody in private practice. How may clinics, in your view, potentially evolve now that we have OTC?
Well, I think I think there's two comments that I'd like to make here. So first is in optometry, when readers came out, like, in part of my business, I work with optometry clinics. And so I don't know a lot about optometry, but a little bit. And so I've learned that when readers came into the market, there was this big scare, right? All the optometrists were wondering if they'd get put out of business. And you know what? It grew the whole market and optometrists got busier. And then Warby Parker came and this direct to consumer, 1-800 contacts and these sorts of things. And everyone was so scared that direct to consumer was going to put everyone out of business. And one of the things that people can document now is that if a Warby Parker goes in across the street from you as an optometrist, you will get busier. Some of those patients you'll lose, but the whole thing sort of grows, right? And I think I see OTC as one of these situations where this is an opportunity. It is a gigantic unmet need, right? It's a gigantic unmet need, and it's an opportunity for us to grow from just a commercial perspective, grow the whole market, and in the process, help a lot of people. So the second point that I'll make is as an ENT doc in my community, one of the things that I think is becoming increasingly clear is that if we are providing substandard, mediocre hearing care, patients will be able to get that through multiple channels, and we then become obsolete, right? So I think that it just means that where we as ENT clinics and independent audiology clinics, we need to be truly at the top of our license and of our specialty. We need to be thinking about things like cognition. We need to be thinking about doing speech and noise testing. We need to be thinking about bringing in other service lines so that we establish ourselves in that segment of the market, so that we are the place that they come when their OTC aids don't work, right? So I think that's to me, I think that it will evolve so that everyone will get better. Have to be.
I got to say, I think it's brilliant that you partner with optometry because, as an audiologist myself, oftentimes during training, at least when I hear about multidisciplinary with audiology, usually multidisciplinary is code for ENT and SLPs. With audiology, right? And obviously I have so much respect for my colleagues in ENT and speech language pathology, but we need to be thinking outside the box. We were talking earlier about how there are OTC devices now behind the counter at pharmacies. Could we partner with pharmacists to talk to them about, this is how you can engage with people. And if you are in a small town, you have a private practice, maybe you want to consider putting your business card there, so the pharmacist could refer people if needed. And Carrie, I want to ask this next question to you. How exactly, well, first of all, we hear a lot about improving accessibility, right, to hearing care. What does accessibility mean in this case? And how could OTC hearing aids increase it for older users in your view?
Yeah, so the way that I think about over-the-counter hearing aids is not the end point, but the starting point for really rethinking and expanding how we think about hearing care, so that it opens the door, like in the comments, in terms of truly being able to value audiology's, care in terms of how they can potentially reimburse in the future, when we can have a device here and then eventually potentially, one day have the ability to have audiologists, be able to bill for the services they're truly providing and the value that we attach to that. And I think it is also thinking about things like how can we have audiologists, supervising paraprofessionals, like community health workers, like peer mentors, things like that. Like that's all only possible when we have a device that, is deemed hopefully safe enough for individuals, high enough quality, that we can then think through, what are all these other ways we can get this into individuals' hands. So I hope as a discipline that we don't just stop and say, yep, OTC we're done. We've done accessibility, as everybody's kind of pointed out in the chat and in our discussions. Access is, yes, in part cost, and yes, access is maybe you can get it, at online at Amazon or, at the pharmacy, but, there is still also barriers in terms of whether or not somebody, thinks that they have a hearing loss, whether or not it's something they want to take care of and address, that there's a lot of potential touch points to think through how we are talking about hearing loss, and that opportunity to partner, just like you're saying, way beyond kind of our traditional groups who talk about hearing and why it matters. So our primary care doctors, our geriatricians, everybody is kind of thinking about, okay, here's hearing loss. This is something I know we can do something about. Here's some options. So what those options are going to look like in terms of all the potential models of care, I think are to be determined. But I just hope as a whole, all of us are saying, yep, let's get started. Let's now do a bunch more work in terms of thinking through all of these different fun and important ways that we can connect to our older adults.
Something that I often say is, with the introduction of OTCs, it's not anything that's changing in the hearing care landscape. These aren't necessarily trying to replace what many of us have become familiar in, what many of us have trained to understand. This is adding to our toolkit. Right. And so it is up to us to be creative about how can we get these now to the communities that are underserved, or to communities that have never, ever, come to our clinics in the first place. So thank you for that. That was brilliant.
Can I just add just one quick thing in terms of we as everyone has identified, we are, as audiologists, as ENTs, we are looked to as gatekeepers in the hearing care space. And, as we think about access and we think about equity, we want this to be successful, right? So that we can open the doors and say, yes, this is something that we support. Yes, this is something that, fits into the hearing care landscape. But we do have roles as gatekeepers in this, I think, to have this roll out in a way that is safe, that is something we can stand behind as a discipline and a profession. So I think the more we kind of speak together as, yes, this is the type of innovation we want to see, I think the better and the stronger it will be.
Brilliant again. Thank you. Justin, I'll throw it back to you.
Yeah, so in the last 6 minutes, we'll open it up to audience questions. I don't see a Q&A button. Our moderator, Alex Turin, can pipe in. If we don't have that, then people can just type it into a chat question. That's probably the easiest way. Are there any questions already? I'm just scrolling up here, but audience, feel free to type in questions into the chat box and we will answer. Give people a couple seconds to formulate questions. Now's your time to ask the experts. What are your greatest fears, concerns, hopes, ambitions?
My question, Justin, is that an ear on a picture behind you on the wall?
That's actually headphones.
Oh, those are
It's kind of
headphones.
blurry. Yeah,
Oh.
it's headphones. It's a little doodle of headphones that I got
Right.
from art.com for about $49, and it promptly broke. I tried to send it back and they gave it to me for free.
Nice.
So I glued
thought-
it back together.
I thought it was like a labyrinth or something, some fancy
No, it's
ear art.
merely headphones, as well as my dying plant off to my left.
While people are formulating their questions, Carrie, I actually wanted to go back to you. You were talking, we were talking a little bit about models before, right? And actually, we do have a question that just came in. Justin?
Yes. It took a second to see. So Alejandra asks, could we go over those OTCs approved and those that are actually selling in the market? I think I'm missing something. We briefly mentioned that in the very beginning, but that's a good point, because one of the most common questions I get is, who makes these things? Tell which one do you recommend? So maybe someone could summarize that.
Yeah, I think Nick touched on these earlier, but we've seen Sony team up with WS Audiology to release 2 products. They're both in the ear products. One is rechargeable, one is not.
Is that available today?
It is available. They're both available today. They're on the higher price range. I think they're either $9.99 a pair, and then the second option is $12.99 a pair. We saw Lexi Lumen, like Nick said. There is GN Hearing has the Jabra Enhance. There are some MD hearing aids that have been cleared. Braun has a device. Santro has a device, and Starkey has announced that they are coming out with a device. I'm not sure when that will be on market yet, but we're seeing a lot of in the ear and behind the ear. We're seeing a ton of rechargeable mostly. And the highest I've seen is $16.99 a pair.
I think-
Yeah, you know, oh, sorry, go ahead, Nick.
And say, I think one thing that to keep in mind is there's a lot of OTC labeling happening without necessarily actually going through the process yet. And so if you're getting like really technical on who's gone through the process, it's only a handful that are actually available versus there's a great article from, I think, Consumer Affairs very recently. And I'm blanking on his name, and I should know it because he's a wonderful journalist who has hearing
Guthrie.
loss. Which one?
Is it Guthrie?
Yeah.
Yeah.
And he's very thoughtful, and he actually goes through Amazon and talks about how this labeling is sort of out of control. Like, you know, OTC happened, and companies left and right, whether they've actually got approval or not, are saying that they're OTC. And some of these products have been on the market for a long time, selling direct to consumer, taking advantage of internet e-commerce laws. And so, you know, from a very technical standpoint, there's fewer actual over-the-counter hearing aids than it may appear. And this has been the nature, though, of hearing aids for a long time. None of this is new. This was happening back in, 2017 when these laws were first being discussed.
And you can track this. The FDA medical device databases are public. So there's two that are pertinent for this application. One is the 510K pre-market notification database, and you can search using the product codes, or you can go to the establishment and listing device registration. And so self-fitting OTCs have to submit 510Ks, so their clearances will be under there. Non-self-fitting OTCs, their establishment has to be listed, but they don't have to submit a 510K. So you can search under their establishment and get all of this information.
Excellent. I think we're just about out of time. Any concluding remarks, John?
No, I think the one of the main themes that I'm hearing is this is an opportunity for our profession for within hearing care. This is something that, understandably, some people do have some anxiety because it's new territory. But like I said before, I've always kind of looked at this as it's not overhauling what we've all become familiar with. It's simply trying to add to it. And it's up to us to see how we want to form that going forward, because we all got into this to help people who need support for their hearing. And so I look at this as frankly a net positive in the end. So I thank everybody for joining us this evening. This was an exciting panel to have representation from both ENT and audiology. And so I'm just going to share my screen one more time. 1 second. So again, thank you to Duke University, Department of Head and Neck Surgery and Communication Sciences. For those of you who are interested in CMEs for tonight, they are available. The instructions are right there on the screen, and Dr. Chern, our host, can help me copy and paste some of those details right into the chat so people can click on the links directly if you're interested. And I'm going to wrap up by inviting everybody to please keep in touch. So again, we are the American Society of Geriatric Otolaryngology, or ASCO. We have our website, geriatricotolaryngology.org, and you can find us on Twitter as well as YouTube. But here's a little cheat sheet. If you can't remember the Twitter or the YouTube page, just go remember our website, geriatricotolaryngology.org. Scroll all the way to the bottom, and the links for the Twitter and YouTube are right there. Tonight's webinar discussion is being recorded, and when it is ready, we will be posting it on our YouTube page. So thank you, participants, for joining us this evening. If you joined a little late and you're curious what we talked about in the beginning of the evening, you may watch the discussion there on YouTube. And with that, thank you for joining us tonight, and I hope everybody have a great evening. Take care.
Bye. Thanks, everyone.
Thank you.